Hi, everyone. On today's podcast, we're going to talk with Jencie Richtman, evidence-based birth childbirth class graduate, about her experiences using the evidence-based birth childbirth class to navigate her VBAC experience. Welcome to the Evidence-Based Birth Podcast. My name is Rebecca Decker, and I'm a nurse with my PhD and the founder of Evidence-Based Birth. Join me each week as we work together to get evidence-based information into the hands of families and professionals around the world. As a reminder, this information is not medical advice. See ebbirth.com/disclaimer for more details. Hi, everyone. Welcome to today's episode of the Evidence-Based Birth Podcast. My name is Rebecca Decker, pronouns she, her, and I'll be your host for today's episode. Today, I'm so excited to welcome a graduate of our Evidence-Based Birth childbirth class. Before we get started, I want to let you know we will be talking about cesareans and vaginal birth after cesarean. If there are any other detailed content or trigger warnings, we'll post them in the description or show notes that go along with this episode. And now I'd like to introduce our honored guest, Jencie Richtman. Jencie and her husband are graduates of the Evidence-Based Birth childbirth class with EBB instructor Julie Force. Jencie is a mother of two living in the north suburbs of Chicago with her husband. After feeling overwhelmed in the healthcare system with her first labor and delivery, Jencie used the evidence-based birth childbirth class as a tool to help her with her VBAC with her second child. Jencie, welcome to the Evidence-Based Birth Podcast.
Thanks for having me. I'm happy to be here.
You mentioned it's a little surreal before we start recording. Are you a listener of the EBB podcast?
Yeah, so I haven't listened, to be honest, in a while because my daughter's almost 2 now. But I was listening like crazy when I was warming up, when I was pregnant, when I was getting ready for labor with her.
Awesome. Okay, so how did you find out about evidence-based birth to begin with?
My doula recommended. Okay. And so I started listening to the podcast a lot, and then that's when we registered for the class.
Okay, and that was with your second pregnancy?
Correct.
Okay, so take us back a little bit to your first birth experience. What was that journey like with your first child?
Yeah, so with my first, I really just went into it. I think, you hear a lot about people's birth plan goes one way and then they get into labor and delivery and it goes a whole other way that they didn't anticipate it going. So in an effort to try to eliminate anxiety, I decided that my birth plan was to go with the flow. Yeah. And I really kind of ended up setting myself up for disaster, I guess, in that, because I really had no birth plan. So I went into my birth plan with my obstetrician gynecologist who I'd been with since, I started seeing my gynecologist. And what I learned from that experience was that just because someone is a good gynecologist fit for you doesn't mean that they're a good obstetrician fit for you. And I found my doula and she was wonderful. And she kind of encouraged me to seek a different provider maybe, but she was very, hands off and didn't push. So I didn't take that advice and I just stuck with my same obstetrician. And in the end, I was underprepared and I didn't know how to navigate the health system. And every intervention under the sun took place, even though we were very healthy and had a really healthy pregnancy. And it ended up being a C-section when I don't think it really needed to be. And I mean, I can elaborate on any more of this, but kind of in a nutshell, that's what happened. I walked away with a C-section with a healthy baby and a healthy me when I really think that it didn't need to be. And so it left me kind of emotionally wounded with this experience that I felt like my son was kind of robbed from a birth experience, and I was too, of just kind of like us getting to do it our own way, so to speak. We didn't get that. And I had to kind of emotionally navigate that postpartum. And it took me a little while, but I got pregnant with my daughter fairly quickly afterwards. And so then I was able to kind of pretty quickly say, okay, how do I want to do this different? And that's how I came to the EBB class and taking my doula's advice and doing the second pregnancy differently.
I have a few questions. So kind of going back to that first cesarean, like what made you think that it wasn't a medically necessary cesarean? Like, or was it preventable? What, especially knowing what you know now about
Yeah.
birth, like, and applying that to that
So I could talk
processing.
about this for like hours. So that's why I'm like, okay, I'm going to try to condense it. So it was like from the beginning, it was focused on BMI. Your BMI is high. I
Okay.
wasn't a high risk pregnancy, but your BMI is high. And then it was this baby, once I got later on in the pregnancy, this baby is huge. This baby's head is huge. He was due on the 4th of July. Well, we don't want you to go into labor on a holiday. We need to schedule this. We want to induce you on the 39th week. And, in the EBB class, you learn all about just the different ways that different providers might navigate that there are some providers that believe that the 39th week, that there's some evidence that shows that the 39th week placenta is in its prime. I guess that's where they were coming from with that. But I really wanted to wait to see when he would come on his own. And they
So
were
you
really
started getting the
pushing.
pressure early, like that you were
Yeah.
going to have to be induced.
Yes. He ended
Yeah.
up weighing 7 pounds and 14 ounces. So he was not huge, but they were telling me, oh, this baby's going to be so big. And like everything that we learned in the EBB class about different tactics that they might try to kind of pressure you. I mean, it was by the book, like everything that they tried kind of in.
Like threats about the baby's health and your safety.
Exactly.
And yeah.
Exactly. And I tried to kind of push it off, but I wasn't putting my foot down. I trusted them. So I was like, well, what's the latest that you'll feel comfortable with me pushing it off kind of thing? And she's like, well, then it's a weekend and I really don't want you to come in on a weekend, which if my husband were here, that was the part that he was most horrified about, that the scheduling of it all. And so at any rate, they agreed to let me come in for an induction 3 days after my due date, which, statistically for your first and for a boy really isn't that much time.
Mm-hmm.
But I didn't know any of that because I didn't take the class and I didn't have any knowledge of this the first time around. So I did respond to the induction and my water broke and everything. But then I kind of, like, I would describe being on Pitocin for my body. I just think it wasn't ready. It was just like chaos mode. Like it was too much, too fast, and I couldn't get on top of the contractions. And, I don't mean to scare anyone, but it was just, for me, I just wasn't ready for it. My body wasn't ready for it. So I wanted medication. And I think then getting epidural and then laying in bed, I wasn't able to move around. So then they ended up, calling it failed induction.
Mm-hmm. And what, you had a doula with you during this?
I did. She was wonderful, but she was a very she's like a supportive type of doula. She wasn't like an adversarial doula, which is exactly what I wanted. I wanted like a hold your hand type of doula, not like a march in there and, speak for you. And I think there can be like different kinds like that. But at any rate, then they had kind of turned up my Pitocin without asking me about it. And there was just a lot of that going on. And so then they wanted to do the C-section as a failed induction is what they were calling it. But again, I didn't know any of this until later on, a year and a half later, I'm taking the EBB class and we're all like, my husband and I are like, this is all coming back to us. Like, this is crazy that I think I had only gotten to 4 centimeters. So I never was technically in active labor, but they were calling it a failed induction. But at that point, it had been about 24 hours and they weren't letting me eat, and I was like begging for a cracker. Again, if I had known how to navigate the system, I would have brought food. I would have told them no. I would have gone and gotten something or had my husband go and gotten something to eat. But I didn't know any better. I mean, there's no other way to put it.
And you were just following their instructions.
I was following their instruction. I was just trusting them. Surgery went really well. I didn't like it. It was not something I ever want to repeat, but I healed really well from it and it went smoothly. But the whole experience was just like, it just felt completely unnecessary and rushed and pushed and None of it felt like I was in the driver's seat. And I remember I listened to one of these of a woman who was telling a very similar story to, she had a successful VBAC and her first birthing experience was similar to this. And she just didn't feel like she was in the driver's seat. And I think she described it the same way. And it's just funny because now that I have this successful VBAC, I feel the same way, that it's all about like the level of control. And I think even if I had a cesarean the second time, I think I would feel better about it, just being able to make the choice, informed consent, and just knowing, that I was in the driver's seat the whole time. Where this first time, I just felt like things were just kind of happening to me.
You were a passenger, things were
Yeah.
happening to you.
Mm-hmm.
Yeah.
Mm-hmm.
And from what I understand, this is like super common in the Chicago area because we have a lot
the
of
hospital that I was at.
Yeah.
Very common.
Yeah.
Very common.
Yeah. So this kind of experience we hear a lot of people talking about similar experiences of just being told, kind of pressured into an induction and then not being given enough time, because 24 hours isn't really enough to, induce a first time birthing person for a lot of people, but was presented as this has failed. This process has failed. And you were being, you were fasting the whole time. It's very uncomfortable, so there's a lot that goes into reasons why people are like, yeah, just give me the cesarean because this is miserable. Right. If you're going to do an induction with your first birth before your body is ready, you have to be prepared for it to take 2 to 4 days and nights. And that's hard. Like not everybody wants to do that or is supported in doing that. Your next pregnancy, did you switch doulas too, or did you have the same doula?
No,
Okay.
I love her like so much. It's funny the bond I think you can make with a doula. And at the end of the day, I might just be a job to her. I don't know. But my husband loved her so much because he could go take a break and go get a coffee. But the second time around, I mean, I'm an attorney. I feel like I don't need people to speak for me. I just needed her to hold my hand. And my husband is like a deer in headlights, The second time around, I just heeded her advice. And when she would make like little comments like, you should see the midwives out in Evanston, maybe you want to talk to them. Instead, the second time around, I was like, I'm just going to do what she says, I'm going to go check it out. And that's what I did. And I did call my obstetrician from the first time around when I got pregnant the second time, and I had a phone conference with her and I talked to her about a VBAC, and then I called my doula and I told her about it, and she's like, she's so patient. She tells me, right, well, but I'm just nervous that she might just be telling you what you might want to hear. And then later on, like, she's going to put you back down the same path. And like hearing that at the time, I was like, oh, you're right. And now I think about that and I'm like, of course, like she was so gentle with me, but like, hello, of course that she was right. I was putting myself right back in that same place. And I think that, and I heard this in the EBB class too. I think that we want to trust our providers and we want to trust medical professionals because they're professional. And me as a professional, I want to trust other professionals. But sometimes, they're just not a good fit. And it doesn't mean they're bad at their job or anything, but they're just not a good fit. And you have to go find someone that is going to follow, your same intention with the plan. And that's what I did. And it was night and day, and they treated her better. The other hospital, the other providers, they treated me better. And they treated my baby better. It was just, I don't want to say that like we were mistreated at the other place, but it was just that everything felt like what I had to say was what mattered. It wasn't just another baby, another mom. It was my birth plan. They asked me for my birth plan. The other place, they looked at me like I was, what are you talking about? When I mentioned they made you do, if it was your first child, it was like this little meeting thing with nurses for your first trimester. And I asked them about having a birth plan and what you do with the birth plan. Like, where do I take it? Should I take it to the hospital? And they looked at me like I had 8 heads when I asked them about that. You know what I mean? Where then I go to when I'm in labor and they asked me for it. Do you have a paper copy of your birth plan? At this other hospital. And like, that's just such a night and day difference,
Yeah.
So.
Yeah. The whole environment was different and more supportive of you and your
Yeah.
family.
Yeah. Night and
Yeah.
day.
And it seems like they were almost preparing you in the first hospital to not be in the driver's seat. Like,
Exactly.
like if in the very first trimester telling you like acting like you're crazy for even bringing up a birth plan.
Yeah.
Like,
And
yeah.
I have a very close friend who I referred her to that doctor years ago, and she delivered both of her children with those same providers at that hospital. And I mean, she scheduled her second C-section and she was happy to do that. She loved it. And that's great. That worked for her. She was happy with that. She was happy to schedule her second C-section. Wonderful. And I think that goes to speak that, and that's what I like about the EBB class and like why I've told people about it. I think that what works for one person doesn't have to work for everyone else.
Mm-hmm.
And that's great. But like, that's why informed consent, I think, is such a big deal.
Mm-hmm.
And why it's so critical that we know about it. Because, I mean, as I mentioned before, I'm an attorney. I think that I went into it almost arrogant, thinking, well, I know how to speak for myself. I'm fine. I'm not going to, fall prey to anyone taking advantage. And then really, I was like, what's going on? What's happening the whole time,
Yeah.
So yeah, what fits one person isn't going to necessarily fit the next. And
So in the EBB childbirth class, you've mentioned some things you've learned about, but what was your experience like taking the class with Julie?
it was great. She was wonderful. I mean, she was really gentle, but really well informed. And I think that's a great combo. It was interesting because we were in the peak of quarantine. So I think it's usually in person or at least kind of a hybrid, but we were completely online.
Mm-hmm.
So it would have been, I think it was like the summer of 2020.
Okay.
And yeah, it was great. I think we were the only couple that we were there for our second child. So we had kind of a unique experience. Everyone else did their homework and they were there for their first. So good on them. Hopefully they, had a better birth experience with their first child. But yeah, it was really interesting to kind of see with like every tidbit that we learned, like we had like, oh my God, that happened to us. So that was really interesting.
Lots of aha moments,
Yes, a lot.
like putting the pieces together.
Yep,
Yeah. So it sounds like you were kind of processing your first birth the whole time you were preparing for the second.
definitely. I heard a lot on the podcast and just a lot in different things that I came across in preparing for my daughter's birth, but that a lot of women that felt like their first birth was like traumatic or difficult to digest, that they felt like their second birth experience was like healing for the first. And yeah, I felt like, yeah, there was a lot of that.
Mm-hmm. Yeah. So take us to the end of your pregnancy. I know you had the same doula that you had a bond with. You were with a midwifery group in a different hospital. Like, what
Mhm.
else were you planning for your VBAC, and what was your mindset like?
My mindset was that I definitely had a birth plan. It wasn't far off from what happened with my son, to be fair. Like, I didn't want any unnecessary intervention if I could avoid it, but I wasn't upset necessarily with what I'm not against intervention.
Right.
I'm not against hospital births. I'm not against any kind of medication use,
Mm-hmm.
but I just want to be able to let my body and her body do what they need to do to get to the end result, like the safest way. And, with minimal intervention if possible. So I think that the big difference was just coming up with plans A, B, and C, which I think, the class helped prepare us for. So having like an epidural was still on the plan. I was nervous about it. I wanted to wait and hold off because I was scared that I was going to get stuck to the bed again and then I wouldn't be able to move around. But I wasn't like totally against it. Yeah, I think the big things were just making sure that I knew what I wanted to happen in every situation and have a plan A, B, and C, anything that might come up.
Mhm.
And then having snacks, having comfy clothes, not feeling like I had to wear hospital clothes, just different like comfort tools that we learned about. I still use those flameless candles like for baths. I thought water was going to be like my saving source. And I had really bad back labor with her. I mean, it was really my first experience at like true labor. So I thought I was going to kind of know, but it was a whole new ball game. And the midwife wanted me to get in the shower at one point, and I was like, if I'm in here for another second, I'm going to die. It's awful in here. So, I really wanted, there's one room with a bathtub at Evanston Hospital, and it's just first come, first serve. And I really wanted to get it, but we did not get it. And I don't think I would have even used that bathtub. So, but yeah, just like being prepared for all of those little things and having time on our side. And the midwives were so supportive of that. I had prodromal labor, so it was stop and go for like 10 days. And we just dealt with it. It was a little wacky to deal with in quarantine or in COVID. I don't even remember at what phase that was in entirely, but it wasn't like all hands on deck with the toddler at home. But I do know that my mom was able to come and take him, thank God. And I just was able to labor at home for a while. And then
So
at
how did
one,
you know, you mentioned prodromal labor. How did you know that, like, I don't want to say the real birthing time, but you know what I mean, that the baby was actually going to be coming soon and
because
that
my
it wasn't.
waters broke.
Okay.
So I was like, I'm pretty sure I'm leaking. And then I was like, yeah, I'm pretty sure that that's waters and that's not anything else. And then I called the midwife, and they were just like so easygoing about it. And they were like, well, you got to come in if it's been 24 hours, but like, I bet you're going to go in, full on labor tonight. And my contractions were coming every 5 to 6 minutes or so, but they weren't like really picking up. And then they would kind of stall, and then they come back. And then finally the next morning I went in to get checked, and sure enough, it was my waters. So they were like, you need to go to the hospital. And then they put me on Pitocin, but I was real scared. I was real nervous about the Pitocin because I had such a bad experience, but they were just so kind to me about it, and they were like, I promise this is not going to be like your first experience. It's a very low dose. It's different when we're augmenting. It's very different. I felt like my first experience, they were like, different hospital, different nurses, but they were kind of like, you're fine, honey. Like, just sit down. This experience, they were like, it's okay. Like, everything's going to be okay. They were very soothing, and sure enough, it was fine. I did do, what's the name of it? I did do a narcotic when I got in, because at
An
that
opioid
point,
injection.
yeah,
Yeah.
I
Mhm.
did that because it had been like 30 some hours at that point,
Mhm.
so that I could sleep for a few hours. And then it was full labor when I woke up. And then I labored for a while. And then at about like 9 p.m., they finally checked me, and I was at like 9 centimeters. And then it was about that time. And then I was like, okay, I want the epidural. And my midwife was trying to stall me out. She was like, just let's try to get in the shower. You're almost there. And I was like, no, I want it. Like, the reason I wanted to avoid it is because I was scared that I was going to stall out, but I'm
That you
nearly
wouldn't
there.
dilate. Yeah.
Yeah. And it's been like 48 hours. Like, I need a rest. Like, I'm ready. So we ended up doing the epidural, and then I slept. We all rested while she just kind of worked her way down the birth canal. And then
Okay.
once I felt pressure, woke up and started pushing, and it actually wore off. So I felt her
Mhm.
come out, felt all of it, pushed her out, which was amazing, because then, I mean, like 15 minutes later, I got up and walked to the bathroom by myself. And what a difference that was from a C-section where you're bedridden, Um, I had my son at 8 p.m., and I wasn't able to get up, with a nurse's help until like 7 a.m., where with my daughter, I'm hopping up 15 minutes later after child. That was amazing. That was
You just
incredible.
felt more like yourself
Oh
after
my God,
giving
amazing. And like the
birth.
pictures, I'm all like bloated and huge from my son and my daughter. I'm just like, oh, amazing. Night
Yeah.
and day.
Wow. So you could feel a difference in the recovery with
Yeah.
your
Oh yeah.
body. Yeah.
100%.
Yeah.
100%.
What was it like when your second baby, you were holding them after doing all that?
Yeah, that was the best part. So part of my birth plan was, this is gonna sound really lame, but Kourtney Kardashian, how she like delivered her baby, like she pulled her baby out.
Caught her baby herself.
Yeah,
Yeah.
yeah. And I'm sure for millions of years, I'm sure many women have birthing people have done that. But I thought that would be really cool if I could do that. And so the nurses told me when they looked at my birth plan, they're like, make sure you remind your doula because we're going to be in the heat of the moment. So have your doula, remind you. So my doula was like, okay, Jencie, this is it. This is the moment. She's right here. Do you want to grab her? And I was like, no, just get her out. So I didn't do that. But they grabbed her and they put her on me. And, I was just like, I just couldn't believe the feeling was just so like wild that she was on me and that I was holding her. And like, what a different feeling of, with the cesarean, it was just like, I just couldn't believe like laying there. And it's just such an out of body experience with my first, and like your baby's so far away. And the doctors were like, just look at your baby, trying to distract you, I think. And I was like, I don't want to. I just didn't want my first memories to be like that moment that wasn't a great moment, to be frank. And then fast forward to holding my daughter and you don't have your mama bear instincts quite yet. I didn't. But then fast forward to holding your daughter and it's like your mama bear instincts are fully intact when it's your second. And so you're just like, that's exactly like primal, like what I want to be doing. It like gets me choked up, but like that's 100% instinctually what I want to be doing. I don't even want to be looking at her. Like I want to be holding her. Like I don't want anyone else to touch her. I want her on me. I don't even need my husband near me necessarily. Like I just need her on me. And so it was like the craziest feeling. And then finally, like the midwife kept calling her, and we did know her sex before she was born. She kept calling her him. And so then finally a few minutes had passed and I was like, yeah, do we even know? Like, is she a girl? And then she was like, sorry. Yeah, she is a girl. She is a girl. And so then finally, okay, her sex is confirmed. Like, let me look at her face. And I looked at her and then, she's crying and she's healthy and she's pink. But it was just such a wild feeling, like actually have her on my chest, and it was just like the coolest thing. And I'll never get that with my son. And I wish that I had, but I'm just happy that I got to do that with her. And I'm just happy that his birth experience taught me to be able to do that for her. My doula told me, like, when I was postpartum with him and I was dealing with some kind of just like guilt and trauma from his birth experience with that, she just said, like, hey, like your mama bear instincts don't kick in right away, like it takes a little while. And so to be able to do that with her was just like, it kind of made up for that with him in a way. So they were so wonderful. They let me do the whole golden hour with her. They did all of her tests on me. And she latched right away. And I could never get him to really latch. With his breastfeeding experience, they were like, oh, you have flat nipples. You have this, you have that. You need to put all these things on your nipples and you need to do all this. And again, like the whole thing was just so like artificial and invasive and people were grabbing at my breasts and with her it was just like so organic and like I just put her on me and she latched right away and she breastfed right away and like I think that whole chest experience and her coming right out on me, like she was so calm and all of that was just so smooth. And I think that because her transition was just from uterus to chest to me was just so smooth that the whole experience was just wonderful, you know?
Yeah. Yeah. It makes me think about, a couple things. One, it sounds like you had the golden ticket that second time that we talk about in the class,
Yeah.
the right fit with your providers and your birth setting where you didn't really have to worry or fight. Like it was like everything you wanted was done the way you wanted.
Yeah.
And just even with like needing interventions, but you got the ones that you needed and wanted in an appropriate way, you know? And then the whole thought of, it makes me, I've talked with several people who even recently still are not getting the family friendly or family centered cesareans where they're still, making excuses to take the baby away and not do skin to skin in the operating room and how that's like something that we really need to be calling out hospitals. There's no reason to not that people having cesareans can't have that experience of having their baby on their chest. Unless there's some medical emergency where the person is like incapacitated and can't do it. And yeah, it seems like I'm glad that you were able to kind of have that second healing experience.
I agree. I asked them if they did that for cesareans, and they were kind of cagey about it. So maybe they're not at
At the
that
first
point.
hospital or the second
No, the
hospital?
second one. So
Mhm.
maybe if I would have had, because I was nervous, like if I did need a cesarean,
Right.
would I get skin to skin with cesarean? And I didn't really get a good answer. So I don't know, because that doesn't make sense to me either. Like, why is the baby on just like this table way over there? I don't know.
Yeah.
That doesn't make a lot of sense to me.
Yeah, and it's definitely I mean, for 10 years now, people have been showing that it can be done. Like you can do skin to skin in the
Right.
operating room. So there's really no excuse anymore. I think there's just hospitals need to start doing it and we need to start saying, "Hey, this needs to be an option" because it shouldn't be limited just to people who are able to get that VBAC that they wanted or who have a vaginal birth with their
Yeah.
baby.
They did take her out of the room
Mhm.
for the hearing test, and I really fought them on that. I don't like that. So with my son at the first hospital, that hospital is brand new, so the hearing test and everything is done in the room. So that's the one nice thing about that hospital.
Mhm.
They never took the baby out of the room.
After
With
you were recovered from the
right,
C-section. Uh-huh.
right. With my daughter, that hospital is not as new. So the hearing test was like in the nursery or something. But again, like I had honed in better on my mama bear skills. I'm just going to keep calling them. And no, there's no reason for you to ever take my child outside of my sight when they're that little. I don't want to do that. I'm
Mhm.
not comfortable with it. So I feel like I should be able to say no to that. So I wasn't comfortable with it and I said no. And I was like, well, I'm going to wait for the pediatrician to get here. Pediatrician's like, well, we don't have it at our office. I'm like, really? She's like, you have to go downtown to Lurie's Children's Hospital downtown if you want to do that. I'm like, well, I don't want to do that. She's like, just let them take the baby. And I'm like, well, can I go with? And then they're like, well, no, because of COVID protocol, you can't come with. I'm like, oh man. So it's like, I don't know. There's always something, I think, at hospitals, and that's why people opt for,
Home
you
birth
know,
or birth centers if they don't
yeah,
wanna deal
yeah,
with the red tape. Yeah.
yeah. There's always red tape somewhere. So
Mhm.
yeah, I don't know.
Yeah, that is a hard one, but, I mean, the fact that you're able to keep your babies with you other than that is really
I
amazing,
agree.
especially when you think about how, 10 or 15 years ago, that was not the norm at all. So, aside from your, like, immediate postpartum experience, what about the next couple of months at home as you were recovering from your VBAC? What was your postpartum like?
It was amazing. I mean, I feel like I have nothing to report. It was,
It went smoothly?
yeah, I had less bleeding, went very smoothly. Yeah, I would definitely opt for vaginal birth over cesarean again. So, I mean, we hope to have a third probably. My guess is we probably will try to have a third, and I would absolutely try to go for another VBAC.
Mhm.
Yeah, definitely.
Mhm. What about, like, recovering postpartum during COVID. This is still kind of before vaccines. People are still really afraid to let people in their homes or whatever.
Yeah.
So did you have enough support during COVID with postpartum?
Yeah, you know what's funny about that? On her birthday in the hospital, they were announcing the COVID vaccine is now available on her birthday. Yeah, so I mean, not hugely. That was definitely, so she was born December 17th, 2020. So I called the pediatrician to say like, "Hey, what do you think we should do about visitors?" So they just kind of gave us what they were recommending per the CDC. So we just had 2 people in at a time, basically just grandparents and like aunties and uncles. You have to wear masks and you have to like quarantine for a week beforehand. Obviously, you have to go to the grocery store and go to work, but like please no social events. And we just left it at that, like limit to 2 people at a time. And it was just like per day. And that's all we did. So it was not like we were having people come in and cook us food or like, play with the toddler, take the toddler out to an event. Like there was none of that. And
Right.
I think when you have your second, you're like kind of hoping like, oh yay, someone's gonna come and entertain my toddler
Yeah,
and
take the
show him
toddler out for the afternoon or
and like show him a happy time. And there was none of that. So I think that was a little hard to deal with, but at the same time, it's all that we know.
Yeah,
So you just deal with it.
right. So, Jencie, do you have any advice for our listeners who are planning on entering birth or parenthood soon? Any words of wisdom from your 2 experiences?
Honestly, I have had a couple friends and I truly just tell them to take the EBB class. I really do. I think birth stories are always great too. Sometimes they can scare you too, though. But I think that the class is great because I really think that informed consent is just like a term I hadn't heard. I didn't know enough about it. I had never been in the hospital for anything before I had my son. So I just had no idea how to navigate the healthcare system. So I think just knowing what to expect. With my first, I took the hospital's birth class. And that's really just kind of, in one way or another, some kind of propaganda. It's specific to that hospital and it's not really very educational. So I think just making yourself aware of what the evidence is out there. And it's already been put in a neat package for you in this class. So, I mean, to me, that's kind of a no-brainer. I
Mhm.
also think getting a doula, and my husband will attest to that,
Mhm.
find a doula, because doulas are so amazing. They are there for support for the birthing person and to hold your hand. And I mean, she just held my hand most of the time, but the emotional support that she offered me was priceless. But my husband loved her almost more because, like I said, he felt like he could leave the room and take a break. He could go get a coffee, whatever he needed to do. He felt like he wasn't abandoning me. So yeah, get a doula too. I think is just like one of the best things you can do. And they also just are there to offer guidance, answer questions. Like I wouldn't have found this class if it hadn't been for her.
Mhm. Yeah,
Um,
and it made me think, like, listen to doulas too, because,
right.
some doulas are gonna be a little bit more, like, outspoken about, what
Yes.
they've seen, and some are gonna be, like you said, more gentle and kinda like, "Well, maybe you should consider," but, my guess is your doula had already had, or heard of bad experiences with that first obstetrician that you had, and it's like their knowledge is really important. Like, they hold a lot of community knowledge about who are the best providers and who you can trust with your care, and so if they suggest looking into switching, like, that's a really strong, like, you should definitely take that seriously and consider it. I also love how you've been talking about informed consent, because I would think as an attorney, like, when you work with clients, like, that whole concept of, like, making sure that your client is educated about all their options and that they choose, the path that they want to take. There's some similarities in there, and then with healthcare, like, in just, like, helping people navigate their decisions with knowledge and power. So, Jencie, thank you so much for coming on the podcast today and sharing your 2 birth stories with us. And we appreciate, that you're telling your friends about EBB as well.
Thanks for having me.
This podcast episode was brought to you by the Evidence-Based Childbirth Class. This is Rebecca speaking. When I walked into the hospital to have my first baby, I had no idea what I was getting myself into. Since then, I've met countless parents who felt that they too were unprepared for the birth process and navigating the healthcare system. The next time I had a baby, I learned that in order to have the most empowering birth possible, I needed to learn the evidence on childbirth practices. We are now offering the Evidence-Based Birth Childbirth Class totally online. In your class, you will work with an instructor who will skillfully mentor you and your partner in evidence-based care, comfort measures, and advocacy, so that you can both embrace your birth and parenting experiences with courage and confidence. Get empowered with an interactive online childbirth class you and your partner will love. Visit evidencebasebirth.com/childbirth class to find your class now.